Hi beautiful people, welcome to my channel. My name is Anava. For those of you that are new, my name is Anava and I make faith related and medical related videos. In today's video, I'm going to be talking about the experience that I had in internal medicine. I am currently doing my internship, which is the 2 years after you graduate medical school that you spend rotating the different departments before you go and specialize. So that is what I am currently doing in this season. I figured it would be interesting to come up here and share with you guys my different experiences of the different rotations, and if this is a video that you'd like and more of what you'd like to see on my channel, please do go ahead and comment it down below so that I may know to make more medical related content. Without wasting much more time, let's go ahead and talk about my experience in internal medicine. So first things first, when I was posted or when I started working, the first department that I was put in is internal medicine. And I am very happy that I started with this department because I feel like it was best to get it out of the way and then kind of like go to the other different departments and kind of trickle down in business. Because if you have just stepped into a hospital, you know that IMED is like really the busiest department ever. So I really was happy that it was my first department, and I'm going to try and share my experience to the best of my ability. At the end of the video, I'm going to give 5 tips that I would give to anyone who's about to go into internal medicine. Please stay tuned to hear those tips. The first thing that I'm going to talk about my experience in internal medicine is that it is busy. Guys, it is busy. Like, you know, when you walk through OPD and you see people and people, like more than 3/4 of those people are going to internal medicine. Like, forget everything else. Like, internal medicine has got a busy schedule like no other department, and that is why I was so happy that I started with it first, because I don't think I would survive going through leisure departments and chilling and then being hit with a hard one at the end. I don't think I would have survived that. Internal medicine is busy like no other. It has the highest admissions, it has the highest patients in the ward, it has the highest numbers in OPD. It's just a very busy department. The workload is insane, and not to scare anyone, but just prepare yourself because it is super busy. The rounds are the longest thing ever. You can start your round like at 8 and be done after lunch. Like, internal medicine has no chill, guys. Like, honestly, if you are really quick, or if you're with someone who is really quick, a senior who is really quick, then no problem, maybe you can just do this and that. But then if it's a major ward round, for example, just forget your lunch, just pack it. Internal medicine is crazy. But with that being said, I would also like to say that the beauty of internal medicine is that it's kind of like a puzzle solving department. That is what I loved about it specifically. Like, you get a list of symptoms, you get a list of signs, you get a list of things that the patient is presenting with, and then you kind of like have to put it together to build a picture. It's like a puzzle. You get a piece of this and a piece of this, and then you make a bigger picture to diagnose the patient. And that is what I love about internal medicine. I love the puzzle solving aspect of it because that is what intrigues me. Of course, it is the bulkiest to study. Even back in medical school, you can testify that amongst everything that you studied, internal medicine had the largest amount of content. It is the bulkiest to study. Back in medical school, even now as an intern, I still use my Davidson. Hold on, let me find it. I still use my Davidson. I am faithful to this book. Like, it has helped me through the hardest of hardests in internal medicine. As a medical student, as a doctor, I still browse through this. I know it won't really suffice forever because as I progress, I kind of like know the basics and I have to get something that is deeper. But for now, this really helps me, and I can't even lie. With my experience of internal medicine, the hospital that I practice at, the night calls were crazy. I think I was doing night like twice a week, sometimes even 3 times a week. At that time, there was a shortage of intern doctors, so the numbers were low and the patient load was high, and you were doing night. Like, guys, literally sometimes I would do night 3 times a week. And it wasn't the easiest thing compared to the other departments, and the way I see the night schedule is it was so difficult. But then again, it goes back to me saying internal medicine, like nothing compares to internal medicine, I say. Of course, it has the most pharmacology in it. What I mean is that you'll be using so many different types of drugs. When this doesn't work, you switch to this, because there is no actual treatment like surgery where you just go in and remove the problem. Most of internal medicine's problems are solved by medication. So you have to know your pharmacology, you have to know your drugs, you have to know your antibiotics. That is something that you have to master. One of the worst things about internal medicine for me during my experience was the amount of death I saw. Like, internal medicine, I think, also has one of the highest death rates as a department, if I am not mistaken. Don't quote me on that. I remember when I left internal medicine and I moved to general surgery, I was in general surgery for about 2 months before I certified my first patient as dead. And I remember in that moment it hit me, and I was like, oh my gosh, I've been in this department for 2 months and I haven't certified anyone. Whereas in internal medicine, I wouldn't even go a day, let alone 3, without certifying a body. And for me, like, I don't know how to explain it. Like, I don't know how to explain it. Like, that was my experience with internal medicine. I saw death so much, and it wasn't the easiest. It really wasn't the easiest. And I am happy, like I said, that it was my first one, but I kind of learned how to handle death. The first family that I had to break the news to that the patient had died, I learned that in internal medicine. That was my experience. It wasn't the easiest thing, but yeah, that's on the death aspect. Let's move on to some positives. With internal medicine, you get a mixed population group. So that means you are going to be seeing both male and female. And like, for example, obs and gynae where you only see females, urology where you usually only see males. In internal medicine, you get a healthy dynamic of the two. You get different age groups. I can see an 18-year-old, I can see a 56-year-old, and I can see an 89-year-old. You get such a huge range of age, and I really like that about internal medicine. You're not stuck to one age group. Like, for example, in pediatrics, you're stuck to children. In obs and gynae, you're stuck to females. You kind of get a mixed population in internal medicine, and that is what I loved about it. Another thing I loved about it is that in my hospital, emergency medicine was very closely related to internal medicine, unless it's trauma or anything that has to go to surgery, acute abdomen and the like. But anything else came into internal medicine in the casualty department, and I love that because I love internal medicine. It kind of gives me a rush. If someone, for example, takes some poison, for example, OPP, organophosphate poisoning, and they are rushed there, you kind of like have to fight tooth and nail to save a life. And just the adrenaline that you get in saving a life and seeing the immediate outcome that this person is now stable clinically and they are better, and then you send them to the ward. I love that about emergency medicine. I love the adrenaline and the immediate outcome and pleasure of helping a patient. And that was very closely related to internal medicine in the hospital that I was in. So that was another good thing that I experienced and I enjoyed about internal medicine. All in all, I can't lie, I did enjoy my internal medicine rotation. Like I said, it was the busiest, the bulkiest, and I rarely slept, and I was constantly fighting for my patients' lives and everything, but it was worth it. Because for me, I believe I will specialize in internal medicine. I do believe I am a physician. Yet to discover other departments that will prove me otherwise. But even back in medical school, I had an interest in internal medicine, and I think that's something that I always wanted to specialize in. So for me, all in all, it was a good experience. I did enjoy it, regardless of the bad and the negative that may be there. I love my internal medicine, so that was my experience. I'm now going to give you 5 learning tips that are going to help you in internal medicine. The first thing is that you have to learn your basics. Physiology, learn how your body operates in normal conditions. Internal medicine, you have to understand how the body operates normally for you to be able to pick up when it's operating abnormally. So learn your basics, really dig into that physiology and understand what happens or what could go wrong at any given point of the normal physiological cycle of the body. Number 2, learn your history taking and your physical examination. Your differential diagnosis should come from a history that you have taken as well as a physical examination. You have have to be thorough in internal medicine. You have to ask the little bitty questions that are able to bring you to a diagnosis of what's wrong with the patient. You have to do a thorough physical examination. You have to be able to know how to evaluate every system of the body. Know your neuro examination, know your CVS, know your heart sounds, know what's abnormal, know what a murmur sounds like, know your abdomen and what organ lies where, know your history taken and your physical examination like never before. They are going to aid you so much, especially in OPD when you are the first encounter of a patient. Number 3, learn your radiology and laboratory interpretations. You need to be able to see a lab report. The hemoglobin is low, but the MCV is high. You need to know what that means. You need to know what it means when your red cell distribution width is high. You need to know what it means when your ALT in biochemistry is high, or when everything is normal, but it's just your ALP that is high. I cannot stress this enough. You need to know your CSF for meningitis. Like, study your lab reports and study your radiology. Get to the point where you look at an x-ray and you can immediately spot the pathophysiology that is happening. When you look at an MRI, when you look at a scan, whatever you are looking at, be able to spot the problem and see where the issue is. Of course, you don't need to be at the level of a radiologist, but at least know the basic pathology and be able to identify the disease. The 4th tip that I have for medicine is kind of optional. You can take it with a pinch of salt, but that is be prepared to work through lunch. I learned to adapt in internal medicine that I never went for lunch. I think I can count on one hand the amount of times that I had a lunch break in internal medicine, and I was in the department for 6 months. You just kind of program yourself to work through lunch. If you are the type of person who needs their lunch and you have to go for a lunch, no problem, go have your lunch, but then just know that when you come back, the workload has piled up and is more. I'm the type of person who I do not want to rest when I know there's a lot of work to be done. I'd rather just work through my lunch, get done early, and then just leave. So that is why I put that as an option, because that is what I prefer to do. But if that doesn't work for you, no problem, do you. The last tip that I have for internal medicine is that you have to learn medical terms in vernacular. Majority of the patients that you're going to get at a government hospital may or may not be able to speak English, or they may speak it but just not very well. And when they're trying to describe to you something that they're feeling or an experience that they're having in their body, they may not know the English word for it, and they're going to use the Bemba word or the Nyanja word or whichever language is local to wherever it is that you are. So you have to know your medical pathologies in vernacular. When someone says that they're feeling pain in the mongololo, you need to know where that is. Like, you need to know what part of the body that is. There may be some simple things, of course, when someone comes over and says, oh, ndeluka, they're experiencing fungalashi. One of those small things which are very common knowledge, I hope. For me, I did not know Bemba at all when I started to practice, so I had to pick up very quick on these small things that may seem normal. They were not normal to me, so I had to really pick up on them. But then it goes deeper than that. Like, there are some words even today that I hear and I just have to like stop and then go find someone and say, please translate this for me, because I don't know what that medical word is. So learn your medical vernacular, because it's going to really help you when you are seeing different kinds of patients. All right, people, so that is the summary of my internal medicine experience. I hope this video is going to help you along with the tips that I have given as you prepare for your internal medicine. If you are currently in internal medicine, whether you are a student, whether you're a graduate, whether you're waiting to be employed, or whether you're a full-time doctor, please comment down below what your experience has been and any other tips that you may have for anyone as they prepare for this department. If you did enjoy this video, please go ahead and give it a thumbs up. Go ahead and follow me on my social media. My Instagram is anava.exo. Thank you so much for watching. Bye.